There is a condition that weakens the bones as we age. We are talking about osteoporosis. Most older Americans don't even know that they have it until they break a bone. The bigger problem, though, a lot of people not even tested or treated for osteoporosis. Joining us is physician assistant for Hartford Healthcare, Joan Dobak, with the Connecticut Orthopedic Institute Bone Health Center. Thank you for joining us. Good morning.
Good morning. Thank you for having me.
Of course. Well, this is the last day of April. We welcome May tomorrow, which is Osteoporosis Prevention and Awareness Month.
Right.
What fractures are you seeing? What are most common?
Well, there's almost 2 million fractures in our country every year that result from probable osteoporosis from a simple slip and fall. So maybe a slip and fall on ice here in Connecticut or trip over a rug at home. But a simple fall resulting in a fracture is called a fragility fracture. The most common ones are of the wrist, the vertebral body of the spine, and the hip.
And how are those usually treated?
They're treated through the orthopedic departments at the hospitals, most times, or in the emergency departments. And that's why at St. Vincent's Medical Center, our orthopedic department has expanded to create this bone health center.
And unfortunately, we mentioned that osteoporosis is common as you get older, but as we know, getting older is a blessing as well. So what can we do, I guess, to work, if we can, to prevent osteoporosis?
Yes, prevention is the key, and there's many things that you can do. You should get enough calcium in your diet, and most people need to take a vitamin D tablet as well. A well-balanced diet with foods that are good for your bone health, like fruits and vegetables and low-fat dairy products with lean protein. And you should quit smoking if you're a smoker. That's a major risk factor. And use alcohol in moderation. But lastly, maybe more importantly, is regular exercise, since weight-bearing exercise is critical to keeping your bones strong. So in this month of May of prevention and awareness for osteoporosis, we're encouraging everyone to walk a mile a day in May to start a new exercise program.
I love that. That's a great goal, especially since the weather is getting nicer. A lot of us can spend more time outdoors. So we just talked about ways that we can reduce our risks, but let's talk about the screening process now for osteoporosis.
Right. So the screening tool is very simple. It's called a DEXA scan. It's a 15-minute scan that's very easy and non-invasive, and it uses low-dose radiation that's much less than a regular X-ray. So ladies over 65 and men over 70 should be having a DEXA scan every 2 years. And your primary care provider, or if you're a lady, your GYN provider can order that for you. So ask about it when you're in next to the office.
Wonderful.
But if you have risk factors such as advanced aging or frequent falls, or a parent has had a hip fracture, you should have a DEXA maybe even earlier than 65 or 70.
All good information. Is this some of the work that you guys are doing there at the Bone Health Center at St. Vincent's Medical Center?
Yes. So we started this out of the orthopedic department about a year ago, and we have grown it steadily. Besides our fracture prevention work we do, we now also see our patients who are thinking about having elective surgeries, such as joint replacement surgeries or spine surgeries, and evaluating their bone health before their operation to make sure they're optimized.
Oh, that's wonderful. Joan Dobak, a physician assistant for Hartford Healthcare. Thank you so much for joining us.
Thank you so much for having me.
Absolutely.